Biomedical Ethics. Chapter. This chapters the following topics: ethics, biomedical ethics, principles, pillars of medical ethics, ethical situations and their solutions. Paramedics, nurses, and doctors usually find themselves confronted with moral questions and ethical dilemmas. The context of healthcare provision is changing and is simultaneously giving rise to new challenges, not only for hospital staff but also for healthcare researchers. This chapter briefly explains the concept of medical ethics so that the students may have a general paradigm in their minds. Ethics and biomedical ethics. Ethics is the branch of philosophy which deals with values related to human conduct. Biomedical ethics is the branch of ethics that uses ethical principles and decision-making to solve actual or anticipated dilemmas in the medical field. Basic principles of biomedical ethics, pillars of medical ethics. Autonomy. Patients have the right to control what happens to their bodies. This principle simply means that an informed, competent adult patient can refuse or accept treatments, drugs, and surgeries according to their wishes. People have the right to control what happens to their bodies because they are free and rational, and these decisions must be respected by everyone, even if those decisions are not in the best interest of the patient. Beneficence. All healthcare providers must strive to improve their patient's health, to do the best for the patient in every situation. But what is good for one patient may not be good for another, so each situation should be considered individually, and other values that might conflict with beneficence may need to be considered. 1. Ethical principles, non-maleficence. In every situation, healthcare providers should avoid causing harm to their patients. You should also be aware of the doctrine of double effect where a treatment intended for good unintentionally causes harm. This idea helps you make difficult decisions about whether actions with double effects can be undertaken. Justice. The fourth principle demands that you should try to be as fair as possible when offering treatments to patients and allocating scarce medical resources. You should be able to justify your actions in every situation. Equity. It means that the health sector should deliver healthcare services according to the needs of the community and not merely on the basis of equality. Human rights. The rights that are believed to belong justifiably to every human. Equality. It means that all humans have equal rights regardless of age, sex, nationality, or disease. Utility. The use of resources, which are cost-effective, useful, and most beneficial in the interest of patients and/or community. Fidelity. It covers two aspects, that is, truthfulness, never lie to a patient, and confidentiality, do not disclose patients' secrets. 2. Ethical situations. Situation. A competent adult refuses care because it is against his/her religious beliefs. Solution. Explain the same treatment in a nice way or search for an alternative treatment. A doctor, paramedic, or a nurse should not force a competent adult to receive a care that is contrary to the patient's religious belief. Situation. A patient says that he/she loves you. Solution. Ask the patient close-ended or direct questions and use an assistant if you feel the necessity. Romantic relationships with patients are not acceptable. 19. Biomedical ethics. 1. Situation. A patient wants to commit suicide. Solution. Suggest the patient to remain in hospital voluntarily. The patient, however, may also be hospitalized involuntarily if he/she refuses. 2. Situation. A wrong patient has received an invasive procedure. Solution. A physician, nurse, or a paramedic is ethically obligated to inform the patient that a mistake has been made. This is regardless of the outcome of the invasive procedure. 3. Situation. Family members of a patient ask for information about the prognosis of the disease. Solution. Do not discuss issues about the patient with the family members without permission of the patient. 4. Situation. A pharmaceutical company offers you a reward for advertising its new brand. Reject the offer. However, if you feel that the reward is benefiting the patient or is useful for medical education of paramedics, nurses, house officers, or trainees, then you may accept the offer. 5. Situation. Patient is angry because he has spent a lot of time in the waiting area.